Next one is spectacles. Spectacles are three types we are available is executive bifocal, bifocal and progressive. First one is executive bifocal plus 1.50 add. Or second one is giving is plus 1.50 add with 3 base in prism can be given. It's 51% can be reduction of myopia, and bifocal is 39 is distance and near is giving in same lens is known as bifocal, and progressive lenses is 1.11 to 33% can be reduction is a isophobia and accommodation lag can be used, and plus 2 diopter and 2 base in prism can use. It's a 40% of myopic control can use. So spectacles are three types: executive, bifocal and progressive. Next one is segment of bifocal and progressive additional lenses. First one is myopic trends to under the accommodation at near. So under segment is mainly for near and distance one for distance vision. The result of hyperopic is blur at near and hyperopic blur drive myopia. So it's 1987. No impact of bifocal on a slow myopic progression is not causing any impact or slow down the myopic progression. And 2023 significantly is clinically significant to reduce the progression is over 0.20 diopter over a 3 years. And next one is executive bifocal with prism. So 2010 to 2020 it says some effect of slow progression of myopia found with plus 1.50 executive bifocal and 3 base in prism. 3-year study, 8 to 13-year-old progression is at least minus 0.50 per year. The subject is SV lenses is plus 1.50 bifocals and plus 1.50 bifocal with 3 base in result in single vision in minus 2.0605 diopter to 0.82 mm. So bifocal in minus 1.25 diopter and 0.57 mm. In bifocal progression is minus 1 diopter to 0.54 mm. So both bifocal group is better than the single vision. So bifocal with the prism is better than the bifocals. So more prism is used for this. Bifocal with prism is very good for controlling the myopia. Next one is available spectacle lenses is Essilor, Stella and Zeiss Monovision Pro, Zeiss Myokits and Side Glass Visions are available spectacles. And next one is tropical. Pharmacologically we use the atropine. 0.025% atropine is reduce the progression of onset, and 1 year result in atropine it's reducing the how much progression is reducing is 0.14 diopter progression and 21% is onset, and controlling of minus 0.58 diopter progression and 54% onset of tropical pharmacologically. Next one, atom studies is 0.5%, 0.1 and 0.01% of atropine in phase 1, 2, 3 in 5 years result in phase 1 greater effect in a higher dose with inverse effect during washout. So 0.1% is best over 3 years. And next one, phase 2 is restart on a atropine 0.01%. So 0.5% equal to 24%, 0.1% means if you using the atropine is restart at 0.5%, or we can give the progression of 24. percentage, and 0.1 percentage is you are using is 90 for 59 percentage is giving the progression, and 0.01 percentage of atropine drops we are starting is 68 percentage of progression will give. The progression of the axial elongations is longest in 0.1 percentage group after the 5 year. So 5-year using of atropine drops can increase the 0.1 percentage group. Conclusion: the 0.5 percentage, 0.1 and 0.01 percentage of atropine eye drop reduce the myopic progression along the concentration of dependent of response. So 0.01 percentage of atropine was most effective in controlling a progression and axial elongation of myopia over 3 years without adverse effect. And next one is soft multifocal lenses response enough to wear the lenses during the day, and low and high myopia ortho K can be also more challenges to fit is more than 5 diopter. So low astigmatism, very limited reusable soft multifocal toric is optional. No daily disposable multifocal toric is optional. Ortho K and soft multifocal have similar efficiency, slightly better efficiency with concentric circle designs than aspherical designs. So soft multifocal reduce 38 percentage of myopia progression, and soft multifocal options are given in below. 5 types are there: Bioinfinity, ProClear, and J visions are there. Natural and MI sight, Cooper visions also vision. And ortho K lenses is next one, is very important for the myopic control in overnight contact lens, is using for flattening the cornea curvature. So large pupil fertilization of myopia control is outside. The peripheral myopia defocusing will lies in a pupil. The peripheral myopia defocus will lies outside of the pupil and small pupil and will limit the efficiency of myopic control. The average treatment zones of ortho K is 3.5 mm with 1.5 and 2.0 mm zones of peripheral myopia defocusing. So 5 mm pupil is ideal. So ortho K indicates myopia with up to 6 diopter in sphere. So mainly used for the indication and contraindications are available. So indications means candidates can use the 6 diopter sphere, can use the ortho K, and FDA approval ortho K temporarily reduce the myopia up to the 6 diopter sphere with up to the 1.75 diopter to with the rule astigmatism. And LIU is 2016 attempt the correction of greater than the 4 diopter increase the risk of central staining. Next one is high level of corrections is also increase the risk of decentration of lens, and treating zones are giving the pictures the treatment zones and area of peripheral myopia defocusing. The ortho K is approval for all age, not myopic control. It's ortho K is approval for all age, children's or adult can be given, but not for myopic control. Not only for myopic control and also for flattening the curvature of the myopia also using. So ortho K different types are dream lenses, emerald, paragon, wavelight lens, and Boshan lobes are available. So the myopic control is over now. Thank you.